Okay, so we're going to do this question. It's about a 28-year-old woman who has persistent headaches for the past week. Headaches are pulsating in nature, and she's nauseous. They're worse at night, and they wake her up from her sleep. The combination of headache and nausea makes me think of increased intracranial pressure. But let's read on. Let's see what's going on with her. She also experiences brief episodes of loss of vision, still along the lines of increased intracranial pressure. There is no reports of limb weakness, sensory disturbances, or any history of trauma. She's not on any medication. She's gained 40 pounds in the past year. Okay. So according to the boxes method, our very first step um, in solving a question is to determine the important clinical features. So in this case, obviously the headaches are an important clinical feature of whatever this presentation is. So I'm going to highlight it in yellow. That's going to be one of our clinical features. Ideally, we want to go for around 3 clinical features that we can separate and we can make a diagnosis based on those 3. So we want to choose the most important 3. Weight gain, I guess we can read on. It's something to consider. And then there are no visual deficits, and neurological assessment does not show any abnormalities. CT scan does not show any masses or is unremarkable. As I've always said, the clinical features are usually found towards the end of the question. That's because that's where the most important information is. The most objective information is found in basically the lab portion and the imaging portion. And those are, when you're presenting, that's your objective also. Your SOAP notes, the objective, a big part of it aside from the physical exam is your labs and imaging. So here, the increased cranial pressure is definitely one of our other clinical features. Remember, we are choosing 3 clinical features at most. And then for the third one, we can say that she's had a recent weight gain. So then we can set up our box methods. And even if the diagnosis jumps at you, I still encourage you to go through these 4 boxes. And what are the 4 boxes in case this is your first time watching this? The first box is the clinical features box. You get 1, 2, 3. So we have these 3 items, right? So headache, and then weight gain, and then increased ICP. Intracranial pressure is increased. So this is our first box. The second box is our differential diagnosis. So using our clinical features that we've already, filtered for and selected the most important ones, we're going to come up with a differential diagnosis. In a question like this, that the diagnosis, kind of jumps at you, you might not want to come up with 3, but I encourage you to come up with 3 differential diagnoses. So 1 is idiopathic intracranial hypertension. What would be your second and third? Second, for me, let's put some sort of a mass effect. Although I know the CT scan is clear, but maybe we gotta do an MRI or something like that. And third one, I can't think of anything. Obviously, this is a pretty straightforward question, so it's okay if you already know kind of what the diagnosis is, not to come up with 3. Sometimes the questions are not asking you about your first box, or they're not asking you about your second box, but they are asking you about your last 2 boxes. So for example, what is the next box? The next box is a diagnostic method. Okay. And these boxes are meant to replicate what you experience on the floors as a medical student or as a doctor. Um, so what is our diagnostic methodology when we are trying to prove that this patient indeed has idiopathic intracranial hypertension? And this question in particular does give the answer away. Um, we do a lumbar puncture. So lumbar puncture is important because not only it shows us that, hey, the pressure in your CSF is elevated, but it also shows that relieving the pressure will help with the symptoms. It kind of confirms that if you resolve the pressure, you will resolve the syndrome. Okay, so in terms of diagnostic methods, we have LP, a lumbar puncture, and that's our third box. But this question is asking you about basically the fourth box, which is treatment. So let's use, a different color we haven't used before. I'm going to use black. Treatment for the fourth box. So waiting for the ambulance to drive by. What is going to be our treatment method? And that's basically what the question is asking. Now, a treatment question is often a purely knowledge question. It's not a judgment question. Whereas a differential diagnosis question a lot of times is a judgment question. And the judgment really comes from what clinical features you choose to focus on. Anyways, for the treatment, the way we treat idiopathic intracranial hypertension is that we first want a lumbar puncture. First of all, that's going to relieve all the symptoms. But then, as I mentioned before, it is going to actually prove that relieving the symptoms will improve the symptoms. Sorry, it's going to prove that relieving the pressure will improve the symptoms. And that's important. And then we want to decide if we want to treat this patient or not. So, general treatment, we want to make the patient lose some weight because this is correlated with increased weight. Certain drugs like doxycycline, like retinoids, like vitamin A, can cause this condition. So you want to tell the patient to stop doing that. So a lot of times, if a patient has recently started a drug, the answer to the question is have him stop taking that drug. Once you've taken care of those concerns, you want to ask yourself, is this threatening the patient's vision or not? Because that's really important, because you can lose vision via having too much pressure. It can put too much pressure in the optic nerve, and it can destroy the optic nerve. So you want to ask yourself, does this sound like it's threatening the patient's vision? And in this case, there is brief moments of vision loss. So yes, the answer to that question is yes. So if the answer, so let's put this as treatment. If the question is to threatening your vision is yes. If the answer to the question that it's going to threaten your vision is yes, or if the answer to the question that the symptoms are just basically getting too much symptoms, symptoms are too bad. If your answer to any of these questions is yes, and then you want to treat it with medication. Okay? And the medication you use for this is acetazolamide. There certainly is a place for surgery with a cerebral venous shunt, but that's only in cases that medication can't basically help cure the condition or help control the condition. The important thing to keep in mind in these questions is, I think the easiest thing to forget is that you're going to get a question like this. Somewhere along the history, they're going to include that the patient was started on a medication. And if you're not too cautious that this is commonly caused by medications, you might not spot that, and you might treat this patient as if, treat her with acetazolamide or whatever. But the important thing in that case would be to immediately stop that medication. If you like the boxes method, and if you like how I think about these questions, please feel free to check out my website for more information about me, for more information about some of these methods, and for a more detailed explanation of some of these questions. All right, thank you.